people want to know, was the COVID-19 virus, was that a lab leak? Or was that a virus that came from an animal reservoir that eventually infected humans? So you do address that in your book, and I'm curious to see what your thoughts are.
Sure.
And how do we figure that out?
Well, I'll give a synoptic version of what I said in the book, and that is, in order to be open and honest about things, we don't know definitively, but let's look at data. Since we are scientists and physicians, let's look at the data. So between 75 and 80% of all the new infections emerge from an animal reservoir. That is pretty impressive, number one. Number two, we do not know whether it came from a lab somewhere in China or whether it was a natural occurrence from an animal reservoir. Recall SARS-1 in 2002. Which was shown very clearly in the wet markets of China, where the animal-human interface inappropriately gets together, where you bring in animals from the wild. And it was felt that it was a bat, which harbors these coronaviruses, to a civet cat, to a human. If you look at the situation in Wuhan, and you look at where are the data of there being a lab leak are zero. There's none. I mean, there is an extrapolation. Well, it happened in Wuhan, and there were labs in Wuhan, so therefore it must have come from a lab. Well, maybe it did, but there's no evidence that it did. Yet, some very qualified, internationally recognized evolutionary virologists from Australia, Canada, the European Union, UK, and the United States have made it very clear that when they went and looked at the data, they felt comfortable but not definitive. They felt that the data strongly suggest it came from an animal interface. But I have always said, I keep an open mind. So until we get definitive data, always keep an open mind. But if you look at the data that we have right now and what the evolutionary virologists think, they strongly favor it being a natural jump from an animal species to a human.
Which is the way these things usually happen. Is there another example of a lab error that caused a pandemic or an epidemic that you know of?
No, not a lab error. There have been lab accidents, but it never, ever resulted in a pandemic like this.
Right. So you mentioned the Wuhan Province Virology Institute, and that is also a little bit of a controversy. I guess they had a small sum of money that came indirectly through NIH. And you do mention that in the book, and I don't know if you want to clarify that for people that may be listening to us.
Yeah, it was a $120,000 a year grant from a portfolio that's $6.3 billion. So it's like pencil dust, as it were, compared. And it was to a group that had been collaborating with scientists in China who have done actually very, very good research. But the nature of the grant was to study the surveillance of screening viruses that are in the environment to determine whether or not they actually can infect humans. Not to make them infect humans, but to determine if they can. The thing that gets lost in a lot of the finger pointing is that the viruses that were studied under the NIH subgrant were evolutionarily so far distant from SARS-CoV-2 that any evolutionary virologist will tell you that it would be impossible to have those viruses turn into SARS-CoV-2, even if you tried to do it. You couldn't do it. But nonetheless, because there was an NIH grant that funded research from a really good lab, that actually was the lab that proved the origin of the original SARS in 2002, that because there was that, it immediately extrapolated purely on no data that, it must have come from that lab. But if you show the viruses to the evolutionary virologist, they'll say that you have to have a virus that's close enough as an original virus for you to be able to manipulate it to become something that is COVID. And it's so different that you wouldn't be able to do it, even if you wanted to do it.
But maybe you can extrapolate a little bit more on what you see is going to happen with COVID moving out in the future. Will it be something that has severe manifestations, or will it continue to be less of a concern in the future?
Well, it certainly will not have the extraordinary, devastating impact that it had during the first 2 years when we had, people dying at such a horrible rate that the morgues and the hospitals couldn't handle the bodies. I mean, that's extraordinarily unlikely that will ever happen again, because we now have 5 years of experience of people who have either been already infected and reinfected and vaccinated multiple times, that although COVID is still circulating and likely will be more negatively impacting health than influenza, particularly among vulnerable people, the idea of all of a sudden having another explosive pandemic is extraordinarily unlikely because of the baseline amount of immunity. For example, and I'll give you a very cogent example, we have new variants. Remember, we started off with the ancestral strain. Then we had Alpha, Beta, and then Delta we had in the spring and right before 2021. Then in November of 2021, we had Omicron. And since then, we've had multiple derivatives of Omicron. And so the virus is still a SARS-CoV-2 with a different variant. But the different variants are similar enough in some respects to what most of us have been either exposed to or vaccinated against, that except for the very vulnerable, the elderly, the morbidly obese, those with underlying conditions, the chances of it being a widespread pandemic are extremely low, particularly if people continue to get their booster vaccines. One of the things we know about immunity to coronaviruses, and we've known that for decades for the common cold coronaviruses, that the immunity that you get is not highly durable, like the immunity you would get from a measles infection or a measles vaccination, which is measured minimally in decades and maximally for a lifetime. That kind of immunity you don't get with SARS-CoV-2. What you do get, which is good, is that when you get vaccinated or infected, you have a degree of immunity that may not protect you against another infection, but clearly protects you against severe disease.
Comments about whether or not we'll ever get a vaccine to protect people against HIV disease.
Yeah, Michael, as I described in the memoir, when I left my chief residency in 1972, I had several years of a highly successful career developing therapies for autoimmune inflammatory vasculitises that took diseases that had close to 100% mortality, like granulomatosis with polyangiitis, which we used to be Wegener's granulomatosis. And we did the types of studies, clinical trials like you're involved with cardiology, and we showed that if you use a modified therapeutic regimen that I developed with my mentor, Sheldon Wolf, that you could induce 93% remission. So I did that for multiple years from 72 to 81. When 1981 came and I saw the first cases in the New England Journal of Medicine, but even before that in MMWR with the CDC, first of 5 gay men from LA in June of 81, and then in July, 23 gay men.
Right.
Crazy. I mean, why all gay men? We didn't know. I knew it was sexually transmitted. I knew it was infection, but I didn't know what it was. So I decided, and that was the turning point of my career, much against the advice of my mentors, I turned away from this very successful trajectory in my career and said, I'm going to start admitting these desperately ill, almost exclusively young gay men. And when I say desperately ill, because remember, we didn't have an HIV test because we didn't know it was HIV.
Yeah.
So the only way people would present would be when they had advanced disease leading to clinical manifestations.
Right.
And
We used to
those
call it
years-
GRID, gay-related immune deficiency back then.
Yeah, I mean, we
Yeah.
didn't have a name and we didn't have an etiology until 1983, 1984. We didn't have any therapy until 1987. And we didn't have the combination that dropped the viral load to below detectable until 1996, 1997. So, getting back to your specific question, those years for me, as I described painfully in the memoir, were unusual, unique, and the dark years of my career because virtually every patient I took care of would go on and die a terrible death with very few exceptions. And as you know, as physicians, we're trained as healers, and we were healing nobody. We were putting Band-Aids on hemorrhages, and the frustration of even treating the opportunistic infections. It was like whack-a-mole. You treat the pneumocystis, they get CMV. You treat the CMV,
Right.
they
Oh,
get
yeah. I remember those days. Yeah.
and it was very, very frustrating. The only thing that got me through it was the bravery of and the courage and the dignity of the patients who suffered through that. But the other side of that coin was the proof of the importance of basic and clinical research to solve difficult, life-threatening problems. Because we went from nothing in 1981 to getting an etiologic agent, to getting the first drugs, better drugs. And right now, as you know, someone comes in recently infected with HIV, you put them on a single pill once a day, and you could get the viral load durably below detectable.
Amazing.
I mean, no one would have imagined that that would have happened when we were struggling in 1981, 82, 83, and 84. But I think it's a testimony to the importance of investment in basic and clinical biomedical research.